everybody, and welcome to View from the Hill. I'm State Representative Jessica Giannano, and I'm here today with another guest, one of my friends from the State House, Marc Hymovitz, the Director of Government Relations for the American Cancer Society Cancer Action Network. We're here today to talk about a bunch of different things. I want you to get to know Marc, one of my dear friends from the legislature, hear about the important work that he's doing for the American Cancer Society, and also the intersection in the legislation that we're working on together and how it impacts you, the people of Revere. Welcome, Marc.
Thank you. Thanks for having me here today, and thanks so much for all the work you do for our organization and cancer patients up at the State House.
Thank you. It means a lot, and I think, through our work together, it's something that's very near and dear to my heart and important to me. But I really want the people watching at home to get to know who you are and how you became involved with the American Cancer Society Action Network, Cancer Action Network, or ACS-CAN for short.
Yeah.
Please tell us about how you got here and the organization.
Sure. So I spent some time earlier in my career working as a staff person at the State House for a state representative, and learned the legislative process, met the folks who were up there and doing the work, and decided I really enjoyed that, but wanted to do something different, maybe helping to advocate for a variety of issues. And so I've been at the American Cancer Society Cancer Action Network, or ACS-CAN for short, for actually next month will be 19 years. Wow. I came here thinking I'd spend a few years doing this work, and just have thoroughly enjoyed the work, the people that I work with, the legislators that we work with, and obviously the mission of ACS-CAN is just something that really keeps me motivated every day. Unfortunately, so many people have been touched by cancer, either family, friends, or themselves, and I never would have thought that 19 years later I would still be doing this work, but every day I get up energized because of our mission.
I think it's so important, and I think something that's really unique about specifically what you work on in the State House is cancer knows no boundary. It knows no physical boundary. It knows no socioeconomic boundary. So when you're talking about how the work that you're doing impacts the constituents of Revere and residents in the state of Massachusetts, it's everyone. It's Western Mass, it's North Central Mass, it's our area, it's children, people our age, our seniors. Cancer knows no boundaries. So what you're doing, whether it's work on breast cancer, pancreatic cancer, or more broad legislation like we're going to talk about today that just impacts patients, I think it's really important because the catchment is everyone. And not many organizations can say that, although this is, it's a tough one, because I'm sure every time you sit down with a legislator, there's a story.
Right. Yeah, and it's so true. When you look at what's going around in this country, the hyper-partisanship, thankfully we're a little more insulated here in Massachusetts, but when it comes to cancer, we talk about it. Cancer is nonpartisan, yep. Right? Cancer affects Democrats, Republicans, independents, and everyone in between. Cancer affects people who are living in urban centers, rural communities. It impacts people no matter what their color, race, religion. So it's something that, you're right, too often when I'll sit down with legislators or just talk to anybody, we don't ask the question, but because everybody handles it differently, but oftentimes they'll share their story that either they themselves or a family member has been touched by cancer. And it's something that, because it impacts so many people, we're able to build coalitions of folks who are advocating for the issues that we work on. And it's something that I wish we didn't have so many advocates, because it didn't touch so many people, but unfortunately it does. But it's great to see people sort of take that passion and put it to work in advocating for various policies that can help out folks suffering from cancer.
And I think this in particular is one of those issues where that personal experience and that passion that makes it so personal is actually positive. When you're advocating for issues like this, sometimes that personal influence can be difficult in situations because it can cause conflicts and things like that. But I think when it comes to advocating for cancer policy and cancer care, that personal experience is what makes it so different.
That's right.
And I think people watching are familiar with the American Cancer Society. I think it's a very well-known national organization. But can you tell us what the difference is kind of between the broader American Cancer Society and the American Cancer Society Cancer Action Network that you're affiliated with?
Yeah, so you're right. Most people are familiar with the American Cancer Society. ACS-CAN is simply the advocacy arm of the American Cancer Society. We're part of the American Cancer Society. We are responsible for policy change and advocating for policy change at the local level, the state level, the federal level. We have teams of lobbyists and grassroots staff around the country. We have a presence in every state, and we are fighting for policy change alongside our volunteers in state capitals and Congress. And we've been very effective, thankfully, because of the support from our thousands of volunteers that we have. So simply, it's just ACS-CAN is the advocacy affiliate of the American Cancer Society, which we partner with. The American Cancer Society does things like we're the largest non-governmental funder of cancer research in the country. So we see what's happening to scientific research being cut across the country. The American Cancer Society is there to help fund scientists who do that research. And as an example, and on the American Cancer Society Cancer Action Network side, we're advocating in Congress and with the administration to increase governmental research funding, because it's such an important part of the discoveries that are made over the years to help treat diseases like cancer.
Absolutely.
And so ACS and ACS-CAN go hand in hand.
And I think for your role in Massachusetts, apart from your 50 colleagues in all the other states, that work's happening here.
That's right.
And I think we're so lucky here to have so many amazing biotech companies and different pharmaceutical companies that are developing those incredibly specific treatments and research at our universities in Massachusetts, at our hospitals in Massachusetts. And something in my new role as Vice Chair in Economic Development is being able to go in and see these. And something that was surprising to me, I'd visit a facility and think, okay, this giant pharmaceutical company must be working on millions of different things. One of the facilities was working on 4 specific drugs and treatments for 4 incredibly rare diseases.
Mm-hmm.
I think when you talk about all these things that are happening with cancer in particular, it's so incredible that this research is happening in our backyard.
Yeah, Massachusetts is one of the epicenters of scientific discovery in the country and pretty much the world as well. And so much of the work that's being done in those labs here in Massachusetts started off with basic research that was funded by our federal government. So when people are talking about what does our government do, well, the federal government has provided billions and billions of dollars over the years to fund research that's not always profitable, more often than not profitable, but someone has to fund that basic research so it can get to the point where these companies can then come in and develop treatments from that basic science. And it's why government plays such a huge role, with the research funding at the federal level. Here in Massachusetts, you and your colleagues have passed countless policies that help as well. And these things help they help patients who need to be screened for cancers and other illnesses, need to be treated if they're diagnosed. But it also has a significant impact on the economy in Massachusetts. And all of the research funding that the state and the federal government provides has a significant impact on jobs in Massachusetts. People in your community, I'm sure, all around Revere and the greater Boston area, for that matter, and frankly, all across the state now, because the state has done such a great job, the legislature and the governor, of making sure that the state's investing in this research and in these fields, but across the state, so everybody in Massachusetts benefits.
Absolutely, and I think to have a speaker that is so much of a proponent for public health and so well versed on all of these issues, it's been really helpful for me in the House to kind of follow under his leadership and Chairman Hymovitz in terms of how this legislation is going through the legislative process. But also, there's so much focus right now on research, on healthcare, and on making sure that we stay the leader in the Commonwealth of Massachusetts. And on that, I want to get into some of the legislation,
Sure.
and I want to talk about a bill that we filed together. But also, when you were talking about research, there's another bill that I'm so grateful that the society supported, and that's my bill regarding creating a pediatric cancer trust fund. And when we talk about all of the funding that goes into cancer research, something that really struck me when the Childhood Cancer Organization reached out was that in the last 30 years, there have only been 4 new treatments for pediatric cancer. And any of the developments that they've found have often been an accident. They've been researching another cancer or another treatment. And as a result of those research trials, which I don't think a lot of people realize, so many treatments we find are failures of trials.
That's right.
And we find a discovery for something new. But pediatric cancer is something that's hit Revere hard. We have several students that we've lost and that are battling cancer. So that's why I think continuing to research different solutions for pediatric cancer, different treatments that aren't just aggressive, because we know kids can't be treated the same way as adults by just blasting their cancers with radiation and with chemotherapy, because the long-term effects on their bodies that are still developing is so different than on a fully developed adult.
Right.
And that work's been really difficult. So I don't know how you deal with the space all the time, because it's so hard to hear from these families and hear these stories, but also so incredibly important.
Right. It is difficult, and we're so thankful that we have legislators like yourself that are willing to take this on, because it's a difficult thing. You know, pediatric cancer research is, the funding hasn't been there. There's been failures in a lot of clinical trials, unfortunately, but we can't stop. We have to keep putting funding towards research so we can develop these cures, especially amongst our youngest. And you mentioned kids aren't adults, right? Kids aren't just smaller adults, and so it's the research that's done for adult cancers. You can't just take that and say, okay, well, let's just trim it down a little bit and we'll give it to the kids. It's oftentimes completely different research, and it's so important that we fund that research, and that's why the bill that you filed, we didn't hesitate to support, because we need bills like that to pass so we can expedite some of the pediatric cancer research that's been going on. We hear stories about someone who survived childhood cancer when they were, say, 5 years old, 20 or 30 years ago. Sorry, that they survived it now, but 20 or 30 years ago, someone who had that same cancer, a child, would not have survived. So we've made progress, but especially when it comes to our kids, we need to expedite that process, and that the bill you sponsored will help that out. So,
thank you. And in addition to, I think there are different buckets of issues when it comes to cancer, right? There's research and funding and preventative care. There's what are we doing for our patients that are navigating cancer, and what are we doing after their diagnosis and what happens for the rest of their lives. And something that we're working on together is a bill that I was really excited when you brought to me, and that's the patient navigation bill that we're working on.
Yeah.
So I will give Bob all the information so he can share this at the bottom of the screen. But H 1173 is an act to facilitate timely access to quality health care by expanding access to patient navigation. And before we get into the bill, I want to tell our viewers a little bit about why this was so important when you shared it with me. And this is kind of one of those things that happens in the legislature. Organizations like the American Cancer Society Action Network will come up to us in a meeting and talk about what they're working on and what problems they're facing and what they're seeing in the field. And when Marc brought this bill, when he brought it to my attention, it stuck out immediately because of my family's, like we talked about earlier, my family's experience with cancer. And in my house, many people know, because I've talked about it, my grandmother's a 5-time breast cancer survivor. She's a rock. She's incredible. We lost my grandfather to prostate cancer several years ago. So our families had a very unfortunate experience navigating the system. And my dad and my aunts and my uncles can navigate a doctor's appointment and navigate the hospital in a way that many people can't, because we've done it so many times. And when we talk about patient navigation, it's not only knowing how to advocate for yourself in a doctor's appointment and what questions to ask and how to retain that information when you're getting such difficult news delivered to you, because often when you hear the word cancer, everything becomes a blur. You're not listening to anything else in the appointment, when there are things that you need to hear about aftercare and about appointments and about what happens next. in my family and in our community, my grandmother's become a pillar for others with breast cancer diagnoses because she knows what to ask. She knows who to go to. She knows what to push back on. And she knows that if you book an appointment with one doctor and another, well, that's across the hospital, and you might not be able to get there by yourself. You need help. So this bill to facilitate access to patient navigation was something that I said, yeah, we need to make sure that this is funded by more than just philanthropy. Dana-Farber does an incredible job maintaining this program, but it's with philanthropy. And we know that in tough economic times, which we're facing right now, philanthropy is the first thing we lose. So please tell us a little bit more about the kind of technical side of the bill that, that began the work on it. And
yeah, and I remember having conversations with you early on and you sharing your personal story and your family, and I keep thinking about your grandmother and how many times she's gone through this, and you've described her as just getting stronger every time. And you shouldn't have to go through cancer 5 times to know how to go through to navigate the healthcare system. And our healthcare system is really complicated.
Yeah.
We have some of the best healthcare in the world, but it's a really complicated system. And what patient navigation does is it helps patients and families navigate the healthcare system, whether that's making sure that patients who meet the guidelines for a particular cancer screening get to that screening. First of all, that they know about it, that the screening gets scheduled, and that they show up for the screening. That's the screening part, but then unfortunately sometimes people in those screenings are diagnosed with cancer. So it's navigating through treatments, right? Getting your appointment set up. If you need support, maybe psychosocial support or a nutritionist or something like that, you're not on your own to have to find that support. Your patient navigator will work with you to help you get through that as well. It could be financial issues, figuring out, what does your insurance cover? How can you afford other pieces of it? So it's not just the screenings, the treatments, but it's financial aspects of it. And then we look at navigating the system. Oftentimes people, when they're told they're cancer free, it's wonderful news, but there's still things that go along with that throughout oftentimes the rest of their life, whether it's side effects from the treatments, whether it's mental health issues, whatever it might be. It's patient navigation is there for survivorship as well. So it's through the entire cancer continuum. And I work for a cancer organization, but the bill is not just for cancer, it's for other serious illnesses. So when I speak about it here in the context of cancer, that's the organization I work for, but it's important for us too that it's disease agnostic. So if it's a completely different issue, illness, and it meets the criteria, that person should have access to patient navigation as well. The reason we needed the bill is because not everybody is benefiting from patient navigation, and you touched on the key issue. The way to make sure that the most people and everybody can benefit from patient navigation is to reimburse for the services and to make funding for it sustainable. It exactly what you said is the point. Up until now, it's funded by grants, by private institutions, by charities, and when the economy slows down, it's some of the first funding to go. And it shouldn't. Patient navigation is so important, and it's evidence-based. There's countless evidence out there that shows it's better for the patient and quality of life and patient outcomes. It's better for our healthcare system, and it can save costs. We were actually, over the last few years, before we filed this bill, we're thinking about putting together a pilot program to show the benefit of patient navigation. And the more people we talk to who do the work and who are in these healthcare facilities said, no, there's plenty of research out there. We don't need another pilot program. We need sustainable funding, and that's exactly what your bill will do.
Well, I couldn't be a bigger proponent of the legislation or just the solving this issue in general, because we know it makes a difference. Whether you have a big family like mine that, my grandmother had her daughters and my dad and her son and her family around her, but also you need someone else there, even to physically get from one side of the hospital to another in an appointment, especially when people were navigating this during COVID. They couldn't bring another person to their appointments. They were doing this alone.
Yeah.
And we saw, I think, a big difference in how people's mental health was impacted by that, how their outcomes were impacted by that. So to physically have someone with you to know how to navigate these incredibly complicated diagnoses, I think is critical. And to your point, it's not just cancer, it's other diseases. And something that I've noticed in the State House that I never really thought about before was the correlation between the similarities in people fighting cancer and also diseases like Alzheimer's. And I know my colleague and my classmate and my dear friend is working on another incredible piece of legislation with your organization, and that's the biomarker bill. And the biomarker bill is to, and it's not my bill, so I'm not an expert on it, but it's just something I became passionate about from learning about it through your organization. But basically funds more biomarker testing because there are so many cancers and diseases like Alzheimer's that you can diagnose through biomarker identification.
That's right. Yeah.
And that's incredible to me. And if you want to, actually, I wasn't going to go into it, but talk a little bit about that. That's just something that I found fascinating.
Yeah, and I'll talk about that bill and where it is related to the patient navigation bill as well. And so more and more illnesses, and again, I'll talk about cancer, more and more cancers are being treated with precision medicine today. So instead of traditional chemotherapy that can't tell the difference between a cancer cell and a healthy cell, the chemotherapy poisons all the cells, and that's why there's so many side effects and things like that. These precision medicines can better target the cancer cells. But in order to know whether or not a patient will benefit from that treatment, the doctor needs to find out if they have a specific biomarker, which is a mutation or a certain protein that's there that tells your physician that, okay, they have that protein, so that means they have this type of cancer, just to simplify it, and will benefit from this particular treatment that we know will work, that's more effective, fewer side effects, and oftentimes can save costs because we can eliminate treatments that we know will not work and get right to a different treatment that we know will be more effective. And so there's the obvious benefit to the patient there, but there's also a cost savings to our healthcare system, which, it's not often that you can get better access and lower costs or cost savings. So this is one example of that. And it's related to the patient navigation bill in the sense that we've got a broad portfolio of issues we work on at ACS CAN, whether it's tobacco control, healthy eating, and things like that. But then we've got a large bucket that is access to care, right? We talked earlier about the research and the amazing medical discoveries that have been made over the years. That's all great, and we need to keep that going. But if a patient doesn't have access to those treatments, then it means nothing to them. So making sure that patients have access to patient navigation services is important. And the way to do that is to make the services reimbursable for insurance to cover them. Similar with biomarker testing. Not everybody has access to that because it's not covered under all insurance plans. All insurance is covering some types of biomarker testing, but the science is ahead of the policy, so we're just trying to catch the policy up with the science. But it's all making sure that patients have access to the medicines and the treatments that they have that will help them fight their disease, whether it's cancer or anything else. Because in many cases, we have these treatments, but people don't have access to them for whatever reason, whether it's lack of insurance, whether it's some kind of health disparities, and making sure that everybody has equal access to all of the treatments is important.
Absolutely. And I think anyone that's dealt with an insurance company can relate to how frustrating it can be, myself included. It's difficult to navigate. You're waiting on hold for a long time. You're often fighting with them to have things covered that should be covered. And this is another kind of bigger picture issue that these type of things fall into those buckets, but it's something that we all deal with. It's something that we all struggle with. And I know I myself was arguing with my insurance company a couple of months ago over something. And what was frustrating is, as a English speaking woman that was relatively proficient on how to understand the system, I was struggling and I was frustrated and it was incredibly overwhelming. I can't imagine going through that with a disability or with a language barrier or as a single mother with small children trying to deal with everything else that you're dealing with in your life and you're on the phone fighting with an insurance company. And I think making sure that these things are just kind of built into what you're already paying for is so incredibly crucial. And I know it's a bigger issue. And I know at the State House, we're taking chips at it slowly. I know last session we passed a really important bill for breast cancer, and particularly to make sure that follow-up appointments are covered. Oftentimes women go for their breast cancer screenings and might have a irregular mammogram or something, and they won't go for that second appointment because once it switches from preventative to diagnostic, it wasn't covered. Right. And that's a shame because we know for a fact, it's been proven, that when women didn't go for that second screening, that's when their cancers progressed. That's when their outcomes and likelihood of a better outcome decreased. And that's where problems started. So now with this legislation that Chairman Murphy had championed for so long, covers that second mammogram and that second appointment. And I think, in breast cancer, which is something that I've become passionate about because of my own family's experience, I know how important it is that once you get that off test, you continue. And you test, if you have a family history, you start those appointments young. And if you don't, you start when your doctor tells you to. But that one piece of legislation will be so helpful to so many women as they are on that journey and have those appointments. And hopefully that second appointment comes back clean. Mm-hmm. But if they don't, that detection is caught earlier and it's starting sooner.
That bill, it's not hyperbole to say that bill will save lives.
Absolutely.
The very people that you want to come back for a follow-up screening are the ones who had their initial screening, preventative screening, and they found something. Now, most of the time when a woman has to go back for a follow-up screening, it's nothing. But it happens that sometimes it is something. Mm-hmm. And we don't want to have barriers in place that make it more difficult for someone to go and get screened or to have a follow-up screening. And we talked about it a lot as that bill was going through the legislature, that you shouldn't need legislation to say that a follow-up diagnostic screening because there was an abnormality shouldn't be covered. Absolutely. Right? So thank you to you and to your colleagues and then the governor for signing it. That's a huge bill, and again, will save lives. It's just really important. And one of the other things you were talking about is that you couldn't imagine as a non-white English-speaking woman having to deal with the healthcare system. And a lot of the bills that we file, including the patient navigation bill, one of the major reasons we wanted to file it is to help reduce health disparities. And the patient navigation bill is a bill that will absolutely help reduce health disparities. We learned a lot from COVID, unfortunately, good and bad, but we didn't learn about disparities in COVID, but they were absolutely highlighted during COVID, health disparities. And the good thing that came out of it was it put more focus on reducing health disparities. We have a long way to go. And the patient navigation bill, as one example, will make a huge difference. And in communities that will benefit most from patient navigation being reimbursable are the communities you're talking about. So communities where maybe English is a second language, lower socioeconomic factors, communities of color. Those are the communities that will benefit from making sure that they have access to patient navigation services, and everybody else does as well. But there's been research that shows that patient navigation will benefit everybody, and it will help close some of those health disparities.
Absolutely, and they're right here in Revere. I mean, my district's a minority-majority district. We're a gateway city. We have all of these issues, whether it be language barriers, socioeconomic barriers, and it's crazy to me because I look at some of my colleagues in Western Mass and other parts of the state and the Cape and Islands that have different issues. They might have the issue of getting patients to the hospital, getting them to facilities. We're 5 miles north of Boston and Revere. We are close. It's great. But even still, having an MGH on Revere Beach, getting people from their homes to those appointments, to the follow-up care, it's hard. Right. And it's hard being a gateway city. It's hard whether you're a senior citizen, whether you're a parent, whether you're a single person trying to navigate it alone. Right. Which is why I think this legislation is so critical.
Yeah, and we see it at the American Cancer Society. We've got an 800 number that is there 24 hours a day. They don't give out medical advice or anything, but you can call there and get information about cancer. you can also, we've got great programs, and you can go on to cancer.org as well, great programs like Road to Recovery, because so many people that are going through treatment don't have transportation. We have volunteers that will be matched up with patients that need it through our Road to Recovery program. So we get those calls at the American Cancer Society and can help with some of the stuff. And in addition, a bill like the Patient Navigator program can also help, because in a community that we talked about where there are maybe health disparities, getting cultural appropriate patient navigators is part of what your bill would do as well. So it doesn't help if a community has a large population maybe of Spanish speakers, but there's no patient navigators that speak Spanish. So that's part of what this looks to do, is to make sure that it's not just patient navigators, it's culturally appropriate, that can speak the language, know the culture of the community that they're in, because they're from that community and these are their neighbors, and this is how these patients can get the best treatments and the best care.
Well, I think that's so important. And you touched on something too, and that's community. And I think we're lucky in the city of Revere to have, an MGH on Revere Beach, and to have so many community health centers in our region. And I think that cancer definitely is something that's collaborative. I know in my work in the State House, I've had the opportunity to work with great organizations like the Ellie Fund that also helps with transportation and with things like that, as well as other different partnerships and community-based groups. Can you tell me a little bit about how your organization works with these different kind of local organizations that our viewers may be more familiar with, like the Ellie Fund?
Yeah, and we work with the Ellie Fund and other organizations like that. There's, as you know, there's very few bills up there, especially in this space, that impact one organization or impact the work that one organization is doing. So pretty much every bill that we work on, we work in coalitions with other groups like the Ellie Fund. You mentioned the Alzheimer's Association, the Michael J. Fox Foundation, the American Lung Association, Heart Association. We've got one-pagers on different issues that we're working on like this, and there's a whole bunch of logos or names of organizations listed, because our organization, no organization represents everyone or knows everything, so it's important to work with organizations like the Ellie Fund and community groups that are on the ground. We work with Healthcare for All quite a bit, and they've got folks around the state that are in the communities that know the people in the communities, and we don't want to just come in and talk to folks without creating relationships. But working with community-based groups like you have here in Revere is really important, because they're the ones that know the community and know their neighbors, and it's the only way that we can get things done, is working in coalitions with groups like.
Absolutely, and I think that community support is critical. And I know there may be people watching that say, I have some free time, I want to help, or I'm a survivor and I want to give back. What are some ways that people in our community can get involved with the American Cancer Society and different things that they can do to participate locally to make an impact?
Sure. Well, first, I'll tell anybody who needs information on cancer, whether they've been diagnosed or a family member or a friend, can go on to cancer.org, and there's all sorts of information on there, including some of the programs that I talked about, like Road to Recovery, if you potentially need rides. If you're interested in advocating for the issues that we talked about today or others, you can go on to ACS Can's website, which is fightcancer.org. There's information about the work that we're doing around the country in other states and Congress, and then also right here in Massachusetts. You can drop right down to the state level and see the work that we're doing here, whether it's the patient navigation bill, biomarker testing bill, the tobacco control work we're doing. We'd love to have anyone who wants to turn their passion into advocacy and help us. Please go to fightcancer.org, and we'll take you in, and we'll put you to work and use your passion to help us out.
Absolutely. And if you're watching at home, you can reach out to my office and I can connect you with Marc and with the organization. Also, good news, if you're a Revere resident, there's a chance that your representative's already either signed on to or sponsored most of the legislation we've talked to tonight, because the navigation bill is my bill, the biomarker bill, Rep. Kilcoyne's bill is an incredible bill that I'm already a co-sponsor of. So a lot of that legislation that you see in Massachusetts, we're already working on together. But it's important to share it with your friends and family. Maybe you have a friend in Wakefield and you want to advocate So they talk to their rep. And I think that's what makes it so important. And something that Marc and I were talking about before the show is when you tell your story, you don't have to be an expert on the bill. And to be an advocate, you don't have to be an expert on the legislation that we're working on. You have to be an expert on your story. And when people come in my office and when people come to different briefings that you've held, what I walk away with is their story. I remember the gentleman who was misdiagnosed with Alzheimer's from the biomarker briefing. I remember a woman who was a survivor of inflammatory breast cancer. I lost that one. And how her journey was and what that looked like for her. And 20 years later, how she advocates for those with IBC, which is an incredibly rare breast cancer. I don't always walk away from a meeting and say, oh, they wanted to talk about Bill 1, 2, 3, 4, and this is how it impacted them. But no, I can remember their stories. And I think something that you do so eloquently in the State House is connect survivors and people still battling cancer or people that have already lost someone to cancer in to tell us about what this means to them.
Yeah, it is so important to hear stories. And, I can go in there and tell you about what a bill does and all that. And, it's good. I have to do my job. But what most people remember are the stories. And real quick, I'll share a story of my first meeting when I started the American Cancer Society Cancer Action Network. I had done some of this work in other issues before, and so I'd met with legislators before, and I was sitting down for my first meeting in this job, and it was myself, another staff person, and two of our volunteers who had lost their sister to breast cancer. And I was prepared for the meeting, and we're sitting around a table like this, and I talked a little bit about our agenda and some of the bills, and then our two volunteers, the sisters, started sharing their story and how they lost their sister to breast cancer. And they started crying. I started crying. It showed me that this mission is very different than anything else I had done, and it's because of people's connection with cancer and these two women who had lost their sister from breast cancer. And it's 19 years later, and I'm still moved by it because of their story, and I still remember that story all these years later. And it's personal for them and so many people, and that's why we need laws like this to help people deal with it.
I couldn't agree more. While you're here and you have your audience in Revere, is there anything else you want to share about what your organization is doing, or any other things that you think are really important that they're aware of that's happening right now in the State House?
Well, we've got a bunch of bills up at the State House. We talked about a couple of them. I think what our organization with the American Cancer Society and ACS can do hand in hand, obviously I'm biased, but it's amazing work that our organizations do, whether it's raising money for the research funding that I told you about, our policy work, our programs like Road to Recovery, and a whole host of other different programs that I hope folks will look into if they need it. But we can't do any of it without your constituents, other volunteers, others who have been touched by cancer, and those are the people that are behind our mission and help us do what we do. So we'd love to have people get involved in any way, whether it's on the advocacy side, whether it's volunteering for some of our programs, or just reaching out to your office and connect with us if you need help because you're going through cancer treatment or facing a cancer diagnosis, or a family member or a friend. We are here to help and want you to reach out.
Absolutely. And I think a lot of people will reach out to my office if they have an issue, like an unemployment claim, or, I was in the city council for 10 years, so maybe there's a tree in front of their house or a pothole or something like that, which we still take all of those calls. But I don't think they think about reaching out to my office when it's something like, hey, I can't get to chemo, or I don't have a resource for food this week, and things like that. And there are organizations that specifically work with cancer patients that can get you transportation to your appointments, that can help you with food insecurities, that can help with all of these different issues that people don't think about reaching out. So if you're watching this and you're alone, or you know someone that's struggling, please reach out and we can find those resources for you. I also, anytime I have an opportunity to talk about it, I think COVID was one of the worst times in public health. And even though it's 5 years behind us, so many people postponed those regular screening colonoscopies or mammograms or preventative cancer treatments and appointments that they should. If you postponed your appointment, go to your appointments, schedule your mammograms, schedule your colonoscopies, as incredibly uncomfortable as they are, because we know it is proven in the work that I've seen in the organizations I've worked with, early prevention and detection save lives.
That's right. Yeah, absolutely. And the research is there. There's no denying it. So I appreciate you bringing that up.
Yeah, absolutely. Yeah. Anytime we have an opportunity, whether I'm working with, our doctors from the Ellie Fund or from the Prostate Cancer Action Foundation and Dr. Stern, which we've had some really great partners, I always try to take a moment to make sure our people do that. Because not everyone has a daughter at home like me pushing their parents or grandparents to say, hey, go to that appointment or make sure you do that. So it's important that we remind those that we love that they're going to those appointments and doing that preventative care, because so much of it now with the technology and the research and all these things that we talked about today can be prevented. Not all of it, but even if there's something there, we know the earlier you find it, the easier it is to address it.
Right. Exactly it. And yeah, you said it great, and hopefully folks will listen, and if they need more information, call your office and we can figure out how to get them to the right places for their screenings and all of that.
Absolutely. Well, Marc, this has been so informative for me. I know we've worked together now for many years, but being able to dive a little bit deeper into these issues to talk about how it impacts the people in Revere. So thank you for taking the time to meet me outside of Beacon Hill and in the district to talk to the residents of Revere about all these really important things that we're working on together. I'm so grateful for all the work that you do for the society, for patients, for families, for everyone impacted by cancer.
I want to turn it right back around and thank you, because in order to get anything passed up there, you need a legislative champion, and we have one on so many issues with you, and we really appreciate that, your work on the patient navigation bill, but then supporting so many other of our bills, and then your colleagues as well. Over the years, you've passed legislation that has and will continue to make an impact on the lives of Massachusetts residents, whether it's healthcare reform, where Massachusetts has the lowest uninsured rate in the country, so more and more people have access to healthcare, like we talked about. Flavored tobacco restrictions, so our kids aren't being targeted by the tobacco industry. Massachusetts was the first state in the nation to do that, and it's because of our legislators like you and your colleagues. You talked about the breast cancer screening bill that was passed last session, a step therapy bill to make sure that patients get their medications that their doctor prescribes them and not have to go through hoops to get that medication. I could go on and on and on, and it's because of the work that you and your colleagues in the legislature do and the administration. So thank you for that. We appreciate it.
Well, thank you, Marc. And after hearing, and remembering some of those bills, there's no place else I'd rather be in the world than Massachusetts, and especially in my home, Revere. So I think it's incredible that as a state, we're so far ahead of that research, but being in the city of Revere and being so close to Boston and everything, where everything's happening, it's really incredible. So thank you for bringing that information and sharing that with my constituents and friends out there. This has been another episode of View from the Hill. Hope you all enjoyed tuning in today. Thank you for your time. Go to those screenings and have a great day.